Hi, everyone, and welcome to week 6. This week we talk about culture as it relates to substance use and behavioral disorders. A really great place to start in looking at for cultural differences is in the DSM. Over time, they've really understood that the research has not been as effective for different populations. And so really tried to better understand how do these symptoms show up, or how should they be assessed when we're working with different populations. And so there, for each substance actually, is a cultural section that talks a little bit about specifically that substance and what we see around the world or with different populations that we're working with. So take some time to get familiar with that information, as well as familiar with the research that's out there on, like we talked about before, the interventions that are effective with different populations. Because how we're going to approach any disorder, but also with substance use and behavioral addiction, is keeping culture in mind and making sure that what we're providing is appropriate for the culture that we're working with. So there's a lot of information, not as much as we need. I mean, this is an area that we are growing as a mental health field, and in our substance use field. So begin there, but just know there's more to come. Even as I was putting this together, I went and looked at the SAMHSA website, and they just put a 2020 publication up, which I was able to include in the syllabus. So just know that that information is coming, and keep doing your own research. A perspective of this is also advocacy, and so it is our role as clinical mental health professionals to advocate for clients. And this is one area of understanding addiction. Even for a majority population, is still a disorder that affects people in a certain way, socioeconomic ways. Addiction itself has a stigma attached to it, and many people view it from a moral perspective, that there's something wrong with individuals, and that it's a shameful component of having an addictive or behavioral disorder. And so there's a culture really of understanding those perspectives in general, even from just the population of individuals that deal with addiction symptoms. So we also want to understand that perspective and advocate for individuals who are dealing with this disorder. We see some challenges with payment for services, for addiction services, such as insurance payments or other health payments, cost of services, other access to resources, unemployment, different things that occur because someone has an addiction disorder. And so advocacy is really important for this specific population, as well as just for access to services for any culture that we're working with, any population that we're working with. One particular piece to talk about too is, particularly since we are a Christian university, is understanding religion and the role of religion as well, or spirituality, when working with individuals dealing with addiction disorder. And there is one article that we've included, and some of that is just perspective, is understanding what perspective does religion have when it comes to substance use disorders. And often there can be a judgmental tone that comes with that addiction is just a choice, and it's a bad choice, and it relates to sin, right? But for those individuals who have developed that severe disorder, and we've looked at changes in the brain that we talked about in week 1, to just focus on addiction being a choice kind of dismisses those changes in the brain. So we want to make sure that we're also referring to the science, that we're referring to the brain disease, and that we're finding a way to really integrate what does that mean when we're looking at religion, and what does it mean with spirituality. There's a lot of research that talks about the importance of spirituality in addiction treatment. But that's also different from religion. And so we want to honor people's choices and make sure we are supporting the whole health of the individual. And if we're coming from a Christian perspective, we want to be careful that we're not being judgmental and we're not assuming a moral stance that it's just a choice, because that can further perpetuate that disease. This week you will also do a demonstration, a skills demonstration. You'll see these throughout the program where you have an opportunity to practice with a volunteer, a mock session, and record yourself using skills so that you can get some feedback on these skills before you get to your practicum and internship and then out into your career. This particular one focuses on culture and substance use. And so an individual who's had an injury, is prescribed some medication, is really struggling as a result because no longer working or able to provide for his family, and admits to alcohol use and is kind of lacking some motivation to do much. It's kind of stuck where he's at. And so this is the individual you're working with. Read the case study, the Hector case study, so you can learn a little bit more about him and his background and his culture. There's a little bit that will be left up to you, so you and your volunteer can be a little creative with that. Some things you want to keep in mind. Most of you probably have not taken the skills class yet, so we're really looking at basic skills and grading you on those basic skills. You want to determine what stage of change. We talked about that earlier and some resources on that. When you're meeting with this client, where is he at with the particular behavior you want to talk about, or that you get to? And so again, some behaviors this client may be really ready to tackle, maybe really ready to get back to work, yet is he ready to make some changes with his alcohol use? That will be up between you and your volunteer of where this person is in readiness for change. Your role as a counselor in this session to kind of work with your volunteer to find out a little bit more about what's going on in the present moment and his perspective of those different problems. So you'll start with using one of those assessment tools. I encourage you to use the audit just because it's specific for alcohol use and the client can fill it out. But you can look at some of the others and see if there's another one you would like to try. I encourage you to have the volunteer client kind of fill it out beforehand, so it doesn't take time away from the actual skills recording. Once they've done that, you'll ask permission to say, is it okay if I take a look at this and we have a conversation about it? And using their own words, you're able to really reflect back to them. I'm curious as to why you checked the box that said a family member was concerned about your use. That's one example. And so those open-ended questions will help you engage the client and find out their perspective of what's going on. You also want to make sure that along the way you're really reflecting those values back. What's important to the client in front of you, and helping them see that even if they're stuck in the alcohol use or these other behaviors that might be keeping them from reaching their goal, if you understand their values, if their value is to provide for their family, yet their alcohol use is kind of keeping them from getting up in time in the morning. And that's a kind of a discrepancy between what they really believe and kind of this place that they're stuck. And so gently, we can offer some reflections that help them see that you know, this alcohol use, you know, one of the things I've heard you say is sometimes you have a hard time getting up in the morning. And even though that might be related to some of your pain, you also recognize that maybe the alcohol use the night before is keeping you in bed a little longer than you like, and that's affecting you going out and looking for new jobs. What I do know is what's really important to you is provide for your family. So I'm wondering what you might think about that. So that's a way that we can challenge a client in a non-judgmental way, using their words, letting them see that we see their values, we see their strengths. And so those are the things that we also want to reflect throughout. You'll see on the skills form. So once you record your video, you use some of these skills, you have a form to fill out that's your own reflection. Look at your video. How did you demonstrate the skills to build rapport? Were you engaged? Did you have eye contact? Was your body language present? Or were you kind of slouched back in your chair? Like those kind of things you can identify verbally and non-verbally. How were you present and building rapport and relationship? Were you actively listening? Were you providing those reflections back? And reflections that are identifying meaning. What's important for this client? How does the problem put in perspective of their life? And reflecting back emotions. What do you pick up in the moment that's going on with this client? And offering a few of those. And so those are some of the micro skills that you'll be focusing on. On the skills assessment, look at, you have an opportunity, a box to fill in of what stage of change that you believe this client is in. And so that will help you kind of justify why you use the skills that you use based on that. So make sure that you fill that in your perspective and give some evidence for that. So if you have questions about these skills, you can reach out to your instructor. I encourage you to do some practice if this is the first time that you're recording in Zoom. Often students find some technical issues along the way and it leads to lots of stress and frustration. I encourage you to do some practice runs way ahead of time before you even get with your volunteer, just to make sure that you know the technology. So hopefully this will be a good experience for you and an opportunity for you to get feedback from your instructor.